Well, good evening, everybody. Welcome and thank you for joining us for this evening's event with Maria Smilios, author of The Black Angels, the untold story of the nurses who helped cure tuberculosis. Tonight's program is brought to you by Save Ellis Island, the nonprofit partner of the National Park Service for the restoration and reuse of the historic buildings, which are the hospital buildings on Ellis Island's south side. My name is Denise Chiquette Ryan. I'm one of the Save Ellis Island tour guides, and I'm also a nurse, and I will be leading our new nursing tour later on in the month. I'm delighted to be interviewing Maria this evening. Maria is a New York City native. She has a Master's of Arts in Religion and Literature from Boston University, where she was a Luce Scholar and a Presidential Scholar. Maria worked for 5 years at Springer as a developmental editor in the biomedical sciences and has written for The Guardian, American Nurse, The Forward, Narratively, The Rumpus, and Dame Magazine. Thank you so much, Maria, for being with us this evening. I believe you're muted, Maria.
Hi, sorry, it wasn't letting me unmute the thing. It was telling me that I had to, like, the host. Hi, thank you for inviting me, and I'm so happy to be here this evening to talk about Seaview and the Black Angels and how this story came about.
Well, my first question to you is, what inspired you to tell the story of Seaview and the story of the Black Angels?
So in 2015, as you mentioned in the bio, I was working as a science editor, and I came across a line in a book that said the cure for tuberculosis was found at Seaview Hospital and Staten Island. And I love New York history. I love stories about disease. And I Googled it, and up came this article about Seaview and the cure, and tucked alongside was another article about a group of Black nurses called the Black Angels. And it specifically mentioned one, a Miss Virginia Allen. And so my next thing was I started Googling Virginia. I said, who are these women and why don't I know about them? And eventually I got in touch with Virginia and we started meeting. And slowly this story began to emerge that was more than what had been floating around Staten Island for a while, which was a very kind of whitewashed, hallmarky kind of story of Black nurses came up from the South and worked at Seaview Hospital and were part of the cure for TB. And when she started telling me this, I thought there's so much more to this story. It took place against the landscape of the Great Depression, of World War II, of a city that was trying to find its legs again after the Depression, a city that had been, kind of, people called it like the 20s, the most glorious decade, and then it collapsed. And so that's when I started to probe deeper about this story and really what was going on. And there were two reasons I really wanted to tell the story. One was because it was a story about women, particularly Black women in medicine, that had not been told. These women had been completely erased from one of the most galvanizing moments in global history, the cure for tuberculosis. And two, it is also a story about immigrants. It's a story about people who came to America with hopes and dreams, and they found sickness and tenements and disease and Seaview. I am the daughter of an immigrant. I know what it was like. My grandfather told me stories when he came here in 27, not knowing English, and what it meant to not have a voice, to not be able to communicate and express yourself, and to be looked at as other because you came from another country. And so I wanted to give voice to the patients who were predominantly immigrants and also African Americans. So it was those two things. And also it was just a story of New York, and it had to be told. It's so rich and a part of global history. But it was really those two things that drove me, the story of these women that had been silenced and these patients that had been silenced.
Well, perhaps you can set the scene for us a little bit and by reading a passage from your book.
Yes, I will. Thank you. The Call for Nurses, spring 1929. No one knew exactly how it started or who set it in motion, But in the spring of 1929, suddenly, inexorably, the white nurses at Seaview Hospital began quitting. One by one, they hung up their uniforms and walked out. Their reasons varied. Many of them were weary of the long commute from Manhattan to Staten Island and the successive days of 12-hour shifts. Some cited the chronic mental and physical toll their job demanded. But most were leaving to escape tuberculosis. The Great White Plague, the robber of youth, the captain of the men of death, and its victims, the quote, infected, incurable, indigent, uncultured consumptives. That's who came to Seaview, New York's largest municipal sanatorium. On its floors, hundreds of patients lay in iron-frame beds, languishing, their bodies swarming with millions of arrogant microbes that gnawed at their lungs, kidneys, and tongues, their spines and bones and brains. All day long, they sweated and groaned and cried out. They coughed and choked and spit up blood, each hack sending swarms of live germs onto bedpans and sheets, tables, chairs, and doorknobs. The bacteria landed on walls and nightstands and window shades. It drifted under beds and down hallways, slinking into every room and corner of the ward. It was always present, swirling, lurking, waiting to strike anyone who wasn't already sick. And all it took was a single inhalation. Over the years, the nurses had watched their colleagues fall ill. They saw how their faces turned ashen, how their eyes burned from a fever that climbed and climbed, and how their skin exuded a sickly odor that no amount of washing could eradicate. Some recovered, at least temporarily. Others died in the wards where they once worked, mouthing God in heaven or no, 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 or nothing at all. These days, as the city thrummed and churned and grew, working white women had plenty of options for jobs that wouldn't kill them. They could be sales clerks, cashiers, stenographers, librarians, telephone operators who worked the switchboard at the New York Telephone Company's new headquarters, a soaring Art Deco skyscraper, the exact opposite of the dark and sprawling Seaview. As the weeks passed, the exodus at Seaview became impossible to ignore, and soon word reached the new Commissioner of Health, Dr. Shirley Wynn. A dapper gentleman who was dedicated to his job, Wynn had reorganized the city's infectious disease hospitals and was currently focused on a massive public health campaign aimed at eliminating a different bacteria, diphtheria, an infection responsible for killing thousands of New York's children each year. Months before, doctors had unveiled a vaccine, but previous mishaps with anti-diphtheric drugs had left parents hesitate to vaccinate their children. Frustrated, Wynn began marketing it in, quote, the same manner as chewing gum, a second family car, or cigarettes. Leaflets announcing its safety were slipped in with phone bills, billboards, and illustrated posters that went up in Times Square. Health mobiles, renovated snow removal trucks, retrofitted with refrigerators to store the vaccine, fanned out into the neighborhoods. Inside, a nurse fluent in each area's predominant language encouraged parents to vaccinate their children. But the staffing shortage at Seaview presented Wynn with a different crisis, one health mobiles and vaccines couldn't fix. Tuberculosis had no cure. And so that sets the scene for when these Black nurses are called up from the South. It kind of highlights the hospital they were walking into, the disease, and how desperate the city was to have
Can you talk
bodies.
can you talk a little bit about tuberculosis in the early 20th century? I mean, you started to do that, and the population that it affected,
So,
and basically how it was treated before there were any drugs.
so tuberculosis affected people. Let's put it like this: when the immigrants came from Ellis Island and they stepped onto Lower Manhattan, they either went to Brooklyn, Queens, New Jersey, but most went straight to the Lower East Side, where they found these 80,000 tenements that sprawled and angled within a 2-mile area. Those tenements housed over 2.3 million people, then 2/3 of New York's population. People lived in 300 square foot apartments, 10 to 12 in a room. During the day, they turned it into factories. During the evening, they swept away the day's work and they went to sleep. Tuberculosis, so these rooms, these 300 square foot apartments, Jacob Riis, the famous photojournalist, called them fever breeding structures. They had no windows. TB thrives, the microbe thrives in closed spaces. So this was a haven for the disease. Added on top of that, poor hygienic, there was no toilets, so they were unable to have proper hygiene. They all shared a toilet in the hallway. These were poor people. Food was an issue as well. TB, it spreads, it's an airborne disease. And so close quarters are great. It loves cool, dark places. That's why these tenements were perfect for it with no windows. And if they did have a window, it opened onto an air shaft, but often the air shafts were filled with garbage up to 5 stories high. The only remedy for it was fresh air and sunshine at the time. That was it. This is the pre-antibiotic age that we're talking about. So people who got it were terrified. They knew it was most likely a death sentence.
Now, to talk a little bit more about the Black Angels, the story has survived the oral histories of Staten Island's very tight-knit Black community. Your book is the first definitive recorded account of the heroism of this group of nurses. How do you think a story this big and with such impact has yet to be told? Like, why has it been hidden?
Yeah, I think that there's a multifaceted answer to that. The first one is it existed within the confines of Staten Island in this community, right? And basically it was a community of the Black Angels, the women, and maybe their churches and whatever organizations they might belong to. And so when I came across it, that was one of the things that shocked me the most. I always say it got to the ferry port, but it never went across the bay to Manhattan. I think it has not been told because we're talking about a group of Black women. We're talking about women in science, and we're talking about a population of immigrants. All these, the nurses and the population at Seaview were considered second class and expendable, but mostly the story has no archives. There were no archives. The nurses' story was built completely on oral history, which I gathered over the 8 years that I wrote it. And so that probably was a huge, if anyone was interested, it went nowhere. You really couldn't look up. There were no diaries, there were no scrapbooks, there were no journals. Dr. Robachek's son is alive. He gave me his he gave me his father's archives. So, and from there, I was able to track down some trial patients, but those stories don't exist either. So all of these stories flew under the radar, and anybody who might have heard it or been interested was pulling up nothing at the time. So that might have, I can't say that somebody wasn't interested in it. It just never got far.
Well, you were kind enough to share some pictures with us.
Yeah.
And perhaps if we could look at some of the pictures, you might be able to talk a little bit about them. And here they come.
So that is Dr. Robachek. He's looking at a bunch of x-rays at Seaview Hospital.
Can we have the next picture, please?
Technical difficulties.
We might have to do them one at a time.
So this is a segment of a lung that is, and it shows you what tuberculosis actually does to the lungs. When they say it gnaws through membranes and blood vessels and muscles and tissue, that is exactly what it does. And it creates these giant cavities. You could see that at the bottom, the lung, this person probably had some surgery to cut out parts of the lung, but you can really see what the disease does. And those white spots are all the disease still in there. So it is a really, really harrowing bacteria.
It's a very ugly lung.
It is a very messed up lung. That is Seaview Hospital. It was taken around 1930. It's an aerial view. You can see in the background, actually, those 8 pavilions. They are on a kind of half moon. And in the center of it is the kitchen. And I don't know if you can see it here, but the entire hospital was connected with what they call this above ground tunnel system. There was also a tunnel system underground. The buildings in the forefront were cottages, and those were for people who were still sick, but whose sputum counts, and that counts how infectious you are, were much lower than the ones who were in the pavilions.
Mhm.
This is a patient, and the striking thing about this photograph is it's two things. Number one, it gives you an idea of how the wards were laid out. So imagine a big room, and you have on one side a bed, a nightstand, a bed, a nightstand, and on the other side, it's a mirror image of the side before, and then down the middle. And so there was no privacy. And if you notice the woman in the background, she is sleeping in her bed while the other one is sitting up. And that really depicted life at Seaview. You could be gravely ill and sleeping, and somebody else could be sitting up, and you had no privacy, and you had nothing that was your own anymore. Again, this is another image. When I looked at this photograph, I looked at it for such a long time because I was so moved by her face and the way her fork just seemed to be pushing around the food. And then the doll in the background. So that is the women's ward. This was taken in the late 20s. These porches were eventually enclosed, but what this shows you is the rest cure. So during the day, all the beds were wheeled outside, and patients spent hours outside breathing in fresh air and sunshine. It didn't matter what the weather was, whether it was freezing or whether it was boiling. They were outside because that was the only way that people believed that TB could be cured. And I use cured in quotes. This is a fantastic photograph of the operating room. It wasn't
Yes,
until
it is.
the mid-30s that Seaview had overhead lights. And so if you see that skylight, surgery was done by the whims of the sun. And that is how they operated. That building is still standing. That skylight is no longer there. This is the children's ward in 1950. They were having a Halloween party. And what's striking about this are the children in the gurneys. Tuberculosis in children really went after the spine. And so a lot of these kids were unable to walk, and they were wheeled around in these gurneys.
Mm.
This photograph kind of contextualizes for me a lot of my book takes place in the men's ward. One of the nurses works there. These are men who were ambulatory. They were able to go outside, and they were able to leave. In the background, you can see the hospital, but they were able to just kind of get dressed and hang outside. And you notice that they're smoking. Smoking was permitted. They actually sold cigarettes in the concession, not a concession stand, what is it called? In the store downstairs. They had a store downstairs where patients were able to buy things, and they sold cigarettes and tobacco for your pipes. And you can see that, believe it or not, with their ailing lungs, they were smoking. And that's just another view of the of men again who sat around. Now this door that's what I was talking about. This leads to what's called the track, the tunnels that connect them, and they like to hang around this doorway, I was told. I don't know why, they just seem to migrate to these doorways. And this is the men's ward, and it gives you an indication of these wards were grossly overcrowded, and that's why those beds are down the middle. Those were not supposed to be there. That middle section was supposed to be open.
Well, those were excellent images. Thank you.
You're welcome.
Now, you said that it took you 8 years to write the book, which must have been a very grueling experience.
Yeah.
Can you describe what the research entailed for you? Did you learn anything that surprised you?
So the research entailed hours and hours and hours of interviewing the nurses' families. At the moment, we know of 2 Black angels who are still alive. So I was able to interview Virginia. Virginia came in 1947. So she didn't remember the earlier part of the history. And part of that was she was just too young. The other part was that her Aunt Edna, who is one of the primary nurses in my book and who starts the story, never talked about her past. Edna was born in Savannah on a tar paper shack in 1900, on the floor of a tar paper shack in 1900. She's the daughter of an enslaved man. Her belief was, why look back when you can look forward? And so she didn't talk about her past. So what happened was I talked to lots and lots and lots of people, and they started telling me any bit of information that they had. And let's just take Edna's story. I went back, I went down to Savannah, I went and I looked at old newspapers. And the Black newspaper used to print little, there may be like 50 words of what was going on in the community. Her father had reinvented himself as a preacher. And so there was lots of these little articles about him taking her along with him to do all sorts of things, christenings, funerals, burials, and they would give these little slices of life. And so I took the oral history and then I was able to stitch it together. And I'm looking at your quilt because it really was like a quilting project. It was stitch and stitch at a time. The patient stories were told to me firsthand from them, the two patients who told me their stories. And so that was pretty straightforward. All I did was fact check that. I made sure that the dates they were telling me were correct, that what they were remembering, for example, of the pill that they took was correct. One of the things they did not do was negate anyone's experience. So for example, Virginia recalls her time in pediatrics. As she says, it was a happier time for her. It wasn't what the logbook said. And so I allowed her to have that experience. But then I also said, this is what the logbook said. Because people experience things differently. She was 16, she was young. You know, she often says I was too naive to really understand what was happening. And so I honored whatever experience they told me firsthand was honored, but I also found a way to weave in the history of, you know, in the nurse's logs down the hall from where she was working, this is what they were writing.
Well, you began writing this book long before the world experienced COVID-19.
Right.
COVID-19 brought disease back into focus, very sharp focus. So how did the recent pandemic change the way you approached the angel story?
Wow, that is a very, very loaded question, and I'm going to try and condense it in like a minute. So I rewrote the manuscript 3 times. I originally sold it when Barack Obama was president. We were a country that was moving towards possible universal health care. The culture in the country collectively was different. And so when I started to research it, I started thinking about writing it with an eye towards making a more universal statement. Well, that all fell apart when he left and the Trump administration came in. And suddenly we found ourselves that here we are in a country that is divisive and divided. It is a country where some people believe that certain groups of individuals, based on whether it's the color of their skin, where they came from, or their socioeconomic class, should not have health care. And so I said, I can't write it towards the original way I wanted to. And so I changed it and I rewrote it. And then COVID happened. And I experienced COVID in Astoria, Queens, a mile from Elmhurst Hospital, which was ground zero. I grew up in this area that was a heavy immigrant area. And I heard the ambulances every single day. And I didn't write for a long, long time when COVID first happened, because I mean, we were all shell shocked, but there was I had my daughter home, my husband was home, and we were in this tiny apartment. And I just started to observe, and I started seeing that it was the Black and brown, you know, women, the frontline workers. I would walk down to Elmhurst Hospital and I would see those morgue trucks and I saw those lines snaking around the block. And I thought, this is really a book about who lives and who dies based on the zip code in which you live. And we are living this right now. And so that's when I decided that I wanted the whole story to be undergirded with this premise of health inequity who rises to the occasion to take care of us time and again. And I wanted it to really be a book that would be evergreen, where people could say, we need to look back on history to inform the present moment. And I don't think we're actually doing that right now. It was shocking to me that people were fighting about masks. When I came across that early on, I thought, oh, what? This is weird. Like, who would not want to wear a mask? You go to a dentist, he puts on a mask. And then it became like, you know, the most astonishing arguments unfolding. And then I amped it up in the book, and I said, this has been going on for a really long time. So
Yes.
that is how COVID affected it. And it also, you know, as a writer, you want to experience as much of your story as possible. This was something that I wish I didn't experience. But the idea of the race for the cure that I talk about in the book, and this race for a vaccine, or to at least find out how this virus worked, so we could walk
Right.
out of the house and not feel that if we touched a banana, we were going to die. Because that's the way it was in the beginning. I remember that,
Yeah.
you know?
Yes, absolutely.
And so that is a very short answer to a much more nuanced answer about the correlation between this story and COVID.
Well, before I ask you the next question, I do want to inform the people that are listening that they can enter questions in the chat and we could take them at the end. Um, Maria, what do you hope that people will take away from your story? This story, the story of the Black Angels.
Well, two things. One is that we need to look towards history. We need to have these stories in our historical, I guess you could say, Rolodex, so to speak. They need to be told, because we need to learn from them, not just about these figures, but about disease and disease measures that were taken in a city during a specific time. The second thing is that the story is actually one, despite all of these the appalling conditions nurses work under, and all the things that they endure, the racism, the sexism, the redlining, it is ultimately a story of triumph. It is a story that tells us there are people who are always willing to rise to an occasion, always willing to take care of us. We saw it again during COVID. And in doing so, these particular women saved tens of millions of lives and changed the global face of history when it came to the tuberculosis. And so I hope people take away that moment of triumph in this story, and what they did. And when I asked the families, do you understand what your loved ones did? They all said to me, no, they just went to work.
Yeah. Yeah. Well, I'm looking at some of the questions that I see in the chat, and one I think has to be answered first, because the question is, and I guess we haven't really talked about it, is we say that they participated in the cure, but can you describe a little bit of what actually happened at Seaview?
Mhm.
Okay,
Sure.
that contributed to the cure.
Sure, that's a great question. Thank you for asking it. Um, in 1951, Hoffman LaRoche, the drug company, was about 12 miles from Seaview. Dr. Robachek, whose slide you saw, was the acting medical director, and his partner was a guy named Selikoff. And they both worked at Seaview. Selikoff worked there part-time. Robachek worked there full-time. He never got paid. It was all altruistic, what he did. And they get this call from Hoffman LaRoche, and it says, oh, hey, you know, this drug we've been testing on these mice is proving to be really, really positive and fighting tuberculosis. Do you want to test it on humans? And so they said yes. So Robachek and Selikoff. So the criteria for this initial trial with the drug called isoniazid, they started off with 5 patients, was death had to be imminent, and all the other methods had to be tried and had failed. And at that time, there was a drug called streptomycin, another one, it was a combo drug, streptomycin and PAS, any kind of surgery. So they went and they got consent, and they started off these trials with 5 patients. And the nurses were tasked. They were the ones who gave the first doses. And so they were tasked to oversee these 5 patients. When the 5 patients showed improvement, they added 90. And so this is really where the nurses stepped up. And Dr. Robach said, without the Black nurses, none of this would have been possible. The nurses were the ones who were at bedside all the time. They were the ones who were looking at the emotional, the physical, and the mental state of these patients who were on death's door, and then suddenly they were given this drug. I don't know if people have seen the movie Awakenings, when suddenly the patients wake up.
Mm-hmm.
That's really what happened within like weeks. So they kept these notes. They took their blood pressure, their sputum counts, but mostly what they did was they watched them. And I love this story. One of the nurse's notes wrote that the patients started twitching at night while they were sleeping. And that's just an indication of not only how astute they were, but of what they had to do. Like the person was under a blanket and they saw them twitching. And then Robach would come with Selikoff, collect the notes, and they began what was like a spreadsheet. It's like whatchamacallit, an Excel spreadsheet. And they were like dizzy, twitching, and they started counting how many patients had this, how many patients had that. And that's how they learned the side effects. But it was really the nurses who were bedside every day,
Right.
administering the drug,
symptoms.
and so the doctors kind of breezed in and out. And that was really, it was all them. It was all, and the thing was, they didn't know how it was going to affect people. And for some people, they started to get giddy or angry, and so they had to deal with those emotions as well, you know. And then there were people who were on death's door and suddenly they were alive, and it mentally, for these people, it was a big leap, and they were contending with that as well. All the emotional, I guess I don't want to use the word drama, but all the emotions that arise from you're suddenly dying for years. These were called lungers. That's what they called themselves,
Right.
lungers. They're dying, and then suddenly you're living. And it was a really big emotional and mental leap for some of these people.
I'm going to just take some of these, look at these other questions. And somebody is expressing an unbelievable impression of allowing people with respiratory diseases to smoke, but you know, it was a thing. That's what you did.
They didn't realize the detrimental effects of tobacco at the time.
Someone is asking, is there any actual medical benefit to the fresh air for TB? Obviously, people were not getting healthy, but did it help?
So in some people, it actually did. Those where the disease was caught early, if they were outside, it wasn't necessarily the fresh air that cured them. It was the fact that their disease was caught early enough, and they were able to it was able to be arrested either by some kind of lung collapse or surgery. I guess just in general, sunshine is good. The TB microbe does not live in sunshine. It dies in ultraviolet light. So what it did was it mitigated the spread. But in terms of actually curing people by sunshine and fresh air, that's probably no. There were no cures happening yet.
But it
made them feel
right.
better, you know. I mean, some people, it made them feel better, because don't forget, Seaview is 400 feet above sea level. It's freezing up there. And when that North Atlantic wind comes sweeping up that hill, I've been there in the winter time. And I can't imagine being 5 stories high in a balcony and just sitting there. It is like ice.
Someone is asking, well, first of all, they thanked you for telling the story. And they're asking, have you thought about the infirmary at the Convent upstate New York? I'm not familiar with that. Are you?
No, can the person clarify the infirmary at the Convent? You're not talking about Saranac Lake.
Can the person who asked that question maybe elaborate on the question a little bit more? And while we're waiting for that, there's also another question about how involved was the New York City Department of Health? Were patients forced to go to Seaview?
Yeah, that is a great question. So the New York City Department of Health was extremely involved. Dr. Herman Biggs, who was the mastermind behind the idea to build a hospital to, quote, keep other people safe from the carelessness of those who were sick, worked for the city. He was not the commissioner of health. He held his title eluded me, but he had this idea that he wanted to eradicate tuberculosis in a single generation. And so he instituted these very draconian measures. And one of them was a disease map. And so what he did was he sent out nurses and doctors to the tenements and up in Harlem. And he said, come back to me with all the names of the people who are sick. And they would come back and he would turn behind him on his wall. He had a map of the city and he started putting these little black dots. And soon he saw clusters, and they were all on the Lower East Side and all up in Harlem. And so that's where he went to the city, the newly formed, well, at the time, it wasn't the Department of Health. He went to the city, the New York City Health Department, but that's not what it was called back then. And he said, we need to build a hospital because look at what's happening here. These are like a petri dish of disease. We need to put these people in a quarantine situation and get them off the island because they're going to make everyone else sick. And so the city gave him the money, and Seaview is part of New York City Health and Hospitals.
And Staten Island is kind of, at the time especially, kind of rural.
It was extremely agrarian. It was a bucolic, I think there were 450,000 people that lived on Staten Island in 1929 when the nurses started coming. You still had cows and goats and all sorts of farm animals grazing. It was beautiful. It was like being in the country. It was a completely different place than if you went 5 miles across the harbor and saw the lights of the city.
Correct. You wouldn't know you were in New York. Someone is mentioning that fresh air and good nutrition was also prevalent in the preventoriums like Lake Owasso in St. Paul, Minnesota.
Yeah, that was the gold standard treatment, just fresh air and good nutrition and rest, because there was nothing else they could give. There were no drugs. There were no, they had no remedy. So it was across the board, this idea that rest and good nutrition and fresh air would cure.
Okay, so we do have a little more clarification about Convent. It says the St. Bernadette Convent became a sanatorium in upstate New York, mostly people with respiratory problems in the 1940s.
I am not familiar with the convent, but I'm going to get off and I'm going to look it up now.
Yeah, aren't we both? Okay, so this is an interesting question. How can you share how the family of the Black Angel nurses feel about the world being exposed to this story?
I love this question. Earlier today, I did
It's a great question.
It is. I love this question. Earlier today, I did a segment with some of the family members for NBC. It will air on Friday and over the weekend. And they asked that exact question, like, how do you feel now that the book is out? So I'm just going to parrot what they said to the producer this morning. They are thrilled that their loved ones are finally getting recognition, that they're being seen for their contributions, which they never really understood until the book came out. And so it was all positive joy, basically. As for the world knowing, I'm not sure it's quite there yet, but I'm hoping it's going to get there. The book came out in London, but for me, I wish it would just go across the entire globe.
That would be wonderful. That would be absolutely wonderful. The story is about the Black Angels who took these jobs to escape Jim Crow labor laws. They saw unimaginable things in the operating rooms. How did the nurses survive mentally where operations were turned to butchery? According to your book, ribs were sawed off in bushels, chests were stuffed with ping pong balls.
So that quote, the bushels of 6 to 8 came from Dr. Robach. He had been asked to write his impressions on Seaview. The nurses did their job. I have asked the families. So the problem it was that the nurses are not alive. Virginia was not an operating room nurse. She worked in pediatrics. Her aunt was in the surgical ward. I asked the families, how did they survive seeing people die all the time? You know, one patient described to me there were hearses that see you when you go into the administration. There's a kind of roundabout. They said you could see the
Mhm.
hearses idling 10 to 12 all day long. Bodies were being, ushered out of the building. And so I asked, like, what did they do to take care of themselves and some self-care? And many of them said they just went, they did their job, they came home. In Missouri's case, if somebody died, she took her Bible, she sat quietly, her family knew to leave her alone. Um, and the next day she just went, she was fine, not fine, but she was fine in the sense that she went back to work. So that question, I wish I could have asked them, really, what did you feel when you were seeing this? I know that a lot of times the nurses weren't allowed to talk because they were handmaidens to doctors, and so they knew these patients and they knew that, like, something, I talk about this operation that kind of, the doctor stitches up the girl in this kind of butcher, and he does the stitches, they're very wide apart. They can't say anything. So from one perspective, they were stifled. They would be blamed too if things went wrong. They were called saboteurs at one point if a surgery went awry, or if somebody got an infection. So I wish I could really answer that question to get into their brain, but from the families, when I asked them that, they said they literally just went to work.
Well, I'm going to just interject that you probably could ask the nurses who were taking care of the COVID patients the same thing. How did
Yeah.
they
How did
handle
you?
the constant deaths? But another question here, you mentioned that some nurses traveled each day to Staten Island. Were there residents for nurses on site?
Yes, and Virginia Allen actually lives in the restored nurses residence that sits in the middle of this abandoned complex now. And so the residence originally housed only 200 nurses, and they renovated it in 35 to 37, added another a wing where it was you could add 200 more nurses, and then it fell into disrepair in 1985. It was landmarked, and the city, I think, sold it to a place called Park Lane. They renovated it, and Virginia Allen, who's 93 years old, lives there now. So
that they did have a residence there.
they did.
Someone else is mentioning big
Yeah.
sanitarium outside of Ithaca.
Mm-hmm. Oh,
And
wow.
she mentions that her parents were patients there in the early 50s.
Oh, my goodness. Wow.
So that's something else for
No.
a little
Yeah.
research. And someone else said essentially what I said. I would assume it's like the nurses and doctors who treated patients during the pandemic.
Um,
And go ahead.
what is the status of Seaview today? So,
Yeah.
great question. Virginia Allen lives in this restored nurses residence that's landmarked. She walks out and she sees the hollowed out remains of 4 of the pavilions in front of her on the right, and to the left, in a sort of jumble of weeds and dead trees, is the children's ward. Those buildings are now being used. The fire department is using them to train. The pavilions have fallen into such disrepair. Today, when we were there shooting this segment for NBC, I looked up and there were windows hanging from the frames. There's nothing that they're going to landmark these things. I think they just want them to fall apart. Some of the other buildings on site are being used for a variety of different things. There's a church that's being used as a theater.
There's a ballet company.
The pathology lab, the upstairs, is used for the ballet company. But the rest of them are just kind of shuttered, and they're really falling apart. And it's very, very sad because it is a part of New York history and global history. And I ask people, like, what do we do about this? Like, are they so beyond disrepair that they can't even be fixed? Like, trees have broken through the floors of the pavilions.
The new building is obviously being maintained as a nursing home, but the old
Yes.
buildings, no.
Well, the new building, the Robach Center, which is Seaview Nursing Home, they raised
Yeah.
4 of the pavilions and built that in
Right.
1973,
Right.
I think it was.
Yeah. So what's next for you, Maria?
Oh, I'm not sure. There's a couple of projects that I have in mind. I'm currently really enjoying myself, particularly this month, Black History Month. I did so many different types of talks on the book, and then next month is, well, tomorrow actually, Friday kicks off Women's History Month. So I have a lot of things coming up then for March and April. So right now I'm just focused on the book, talking about it. I'm having, like, I really am having the time of my life. I'm so happy that these women are getting recognition. People are learning the story. I hope it spreads, as somebody said, across the world. Um, I hope they get the recognition that Hidden Figures got, because they are the hidden figures of nursing. And
Yeah,
so if I can do it for the
absolutely.
next couple of months, I will. And then I don't know, I'll think of the next project. There's a couple of things that I have going on, but I'm not 100% sure yet.
Well, on behalf of everyone at Save Ellis Island, I want to thank you, Maria, for participating in
Thank you.
tonight's event. I do want to show the book. Copies of the Black Angel book is available, or that they are available on Save Ellis Island's website, www.saveellisisland.org. This is the book. This is what the book should look like if you purchase it, right? If you see something that doesn't look like that, don't buy
Don't
it.
buy it.
Um, you can also go to Save Ellis Island's website to find out about our upcoming events. I'm going to just say that I have a nursing program that is scheduled for March the 9th. And that is, it's almost fully booked. The next one is June 22nd, and there are other ones scheduled for September and November. We encourage people listening tonight to visit Save Ellis Island's website to become a member, to learn more about the restoration work that's being done and ways you can donate to help save historic Ellis Island and preserve the history for future generations, and to show our appreciation for a donation of $35 or more. Ellis Island will send you a Save Ellis Island notebook and pen set. And our next authors virtual event is scheduled for March 21st. And we will welcome author Carrie Turansky to our program for a talk on her book, The Legacy of Longdale Manor. Thank you, everybody. Thank you so much, Maria. It's been a
Thank you
pleasure
for having
talking
me.
to you tonight, as well as talking to you at other times where we ran into each other.
Somebody's asking about NBC. NBC will air.
Yes.
I believe they told me it will air Friday. It will be NBC Today, and then it will be Weekend Today, which will run all weekend long. So I'm grateful for that it'll just play on that. And then you can hear from Virginia and the other 2 family members who were just so wonderful. These women were just so delightful talking about their loved ones. It's moving.
Yes. Well, thank you again, everyone, for participating tonight. Thank you, Maria, once more.
Thank you so much.
And have everyone have a wonderful evening.
Thank you. Have a great night.
Good night.
Good night.